In today's rapidly evolving medical field, the integration of artificial intelligence or AI and advanced technologies is transforming how we train the next generation of healthcare professionals. Medical students can now use AI-driven simulations and virtual patients to enhance their learning experiences without the need for real biological materials. Let's dive into how these technologies are changing the game and providing invaluable tools for students of medicine. Virtual patient simulations for diagnosis and treatment. AI is enabling the creation of virtual patients who mimic a wide range of symptoms and diseases. These digital patients can interact with students via chatbots, allowing them to practice taking medical histories, diagnosing conditions, and formulating treatment plans. What's incredible about these simulations is the ability to experience rare diseases, atypical presentations of common conditions, or even complex multi-system cases that students may not typically encounter during their clinical training. With AI, students can conduct thorough patient interviews, review symptoms, and build a comprehensive medical history. These virtual patients aren't limited to one set of symptoms. They can evolve over time, introducing new challenges for students to solve. This is especially valuable in fields like emergency medicine or psychiatry, where quick thinking and accurate diagnoses are essential. Artificially generated medical case histories. Imagine if you could practice with medical histories from thousands of real-world cases. AI can generate complex, varied patient histories for students to analyze, creating a rich, diverse learning experience. These simulated cases can include rare diseases, unexpected symptoms, or even combinations of conditions that require in-depth understanding. This AI-generated practice enhances clinical decision-making skills and prepares students for the unpredictable nature of real-world healthcare. For example, AI can simulate a case where a patient presents with both common flu-like symptoms and rare complications, prompting the student to investigate further and consider a broader differential diagnosis. This kind of training accelerates learning by putting students in realistic, albeit virtual, situations where they can learn by doing. Simulating diagnostic tests and imaging. AI is also revolutionizing how medical students learn to interpret diagnostic tests and imaging results. Traditionally, students would practice on real patient scans or work with sample images, but now AI can simulate these tests, creating fake, but highly realistic imaging data. This could be anything from an X-ray showing signs of a bone fracture to an MRI scan of a brain tumor or a CT scan with subtle pulmonary embolism findings. Using AI-generated scans allows students to practice their diagnostic skills repeatedly, without limitations on access to real imaging data. These virtual scenarios also help students gain confidence in interpreting complex images and applying their findings to patient care. Virtual simulation of psychological and psychiatric conditions. Psychiatric training often involves assessing patients who may not always present with straightforward symptoms. AI can simulate patients with various psychological conditions, such as depression, anxiety, schizophrenia, or personality disorders. Students can interact with these virtual patients through natural conversations, analyzing their mental health status, making observations, and practicing therapeutic communication. By training with these virtual patients, students can improve their diagnostic skills in psychiatry and mental health, gaining experience in managing patients in scenarios that may be rare or difficult to replicate in a clinical setting. Personalized learning pathways with AI. One of the most powerful features of AI in medical education is its ability to personalize learning. AI systems can track a student's progress, identify their strengths and weaknesses, and adjust the difficulty level or focus of simulations accordingly. This means that students can receive customized training sessions tailored to their specific learning needs. For example, an AI system might detect that a student struggles with certain types of diagnostic reasoning and adjust the cases it presents to reinforce those areas. By adapting to individual learning paces, AI can accelerate students' overall progress, ensuring they gain a comprehensive understanding of medicine while reinforcing areas where they may need extra practice. Simulating high-stress, emergency scenarios. Imagine being a student in a high-pressure situation where you need to make life-or-death decisions. AI can simulate emergency scenarios, such as cardiac arrest, a major trauma, or anaphylactic shock, in which students must quickly analyze the patient's condition and take action. These high-stakes simulations help students develop quick thinking and solidify their confidence in responding to critical situations. For example, a student might encounter a virtual patient in cardiac arrest, where they need to perform CPR, administer appropriate medications, and communicate with other healthcare professionals, all in a virtual environment. These types of simulations help prepare students for the fast-paced, high-pressure situations that are common in hospitals. AI-powered genomics and personalized medicine training. AI's potential goes beyond simulations of symptoms and diseases. In the future, students can learn how to apply genomics in medicine through AI-powered tools that simulate the analysis of genetic data. Imagine AI assisting students in interpreting genetic sequences, identifying mutations linked to hereditary diseases, and predicting how certain treatments might work based on genetic profiles. This technology is especially useful for understanding personalized medicine. Students can explore how genetic factors influence drug responses and how tailored therapies can improve patient outcomes. AI can help students see firsthand how cutting-edge genetics is integrated into modern healthcare, preparing them for the future of medicine. AI and technology are not just tools, they're game changers for medical education. From simulating complex patient cases and diagnostic tests to providing personalized learning experiences and emergency simulations, these innovations are enhancing the way students learn and prepare for real-world medical challenges. The ability to practice without the constraints of biological material or real-world limitations opens up incredible opportunities for medical students to refine their skills, improve their decision-making, and ultimately become more confident and capable healthcare providers. The future of medical education is here, and it's powered by AI. This technology doesn't just replace traditional learning methods, it enhances them, creating a new era of smarter, more adaptable medical professionals. Are you a medical student or someone interested in the future of healthcare? Let us know your thoughts in the comments below, and don't forget to like, share, and subscribe for more insights into how AI is changing the world of medicine.